All right, so let's talk about these different pelvic floor conditions. Again, I'm Dr. Salil Kandwala, the medical director at Advanced Urogynecology of Michigan. In the URPS, the Urogynecology Reconstructive Pelvic Surgery field, we deal with the bladder conditions, the uterovaginal conditions, and the bowel conditions. So if you look at a clear female anatomy, and you can see the front is here, the back is here, the top is here, the bottom is here. The woman is standing up in profile. The pubic hair would be here. This is the pubic bone. Behind that is the bladder. So the urinary bladder is the storage organ for the urine coming from the kidneys. The urethra is the tube that takes the urine to the outside. Behind that is the vagina. On top of that is the uterus. And behind that is the rectum. The urethra is surrounded by its own musculature, and that maintains it closed and therefore prevents urine leakage. But that is one of the most common conditions, and there are different types of urine leakage called stress urge, and mixed is the combination. Stress incontinence is essentially leakage of urine with strenuous activities such as coughing, laughing, and it affects 1 in 3 women, and especially the younger and more active women. Typically, the bladder and the urethra are here at rest where the dotted line is. Now, when she strains, it should remain there if the muscles and the ligaments are proper. However, if there is weakness of this musculature, then as the patient strains, it tends to draw backwards, funneling open that urethra, resulting in urine leakage. That's classic stress incontinence. Overactivity of the bladder, on the other hand, is where there is uncontrollable leakage following an intense urgency to urinate. And it affects 1 in 2 women, and it's very distressing because the bladder just goes. It contracts and boom, the urine is coming out and there's nothing you can do about it. That's overactivity of the bladder or urinary urgency incontinence. The other condition is difficulty emptying the bladder or urinary retention, which could be associated with a vaginal bulge, and I'll show you in a few seconds. Or it could be without any cause. And then, of course, frequent bladder infections. But there is one more condition called bladder pain syndrome, which is almost has the same symptoms as a bladder infection, but it's completely different, and it's because of the nerve imbalance. Usually the C fibers taking over, causing increased frequency, urgency, and bladder pain, and often misdiagnosed as endometriosis, pelvic pain, and patients may even undergo a hysterectomy. Uterovaginal conditions, mainly the pelvic organ prolapse, and that is when, if you can see right here in profile again, the bladder, urethra, vagina, uterus, and the rectum, they're all very well supported. But when there is prolapse, the bladder is coming down, the uterus is coming down, and the rectum is trying to come outside, and eventually they come outside the vagina as a bulge. This is a large prolapse. And if it's a large cystocele, then the bladder is not emptying, and that can also cause difficulty emptying or urinary retention. From the bowel condition, it's mainly 2 things we manage: constipation and accidental bowel leakage. So the constipation can happen if there is a rectocele or the rectum bulging into the vagina. So the stools are coming down instead of going straight out, they come forward and they get held up in this pocket, and that's the rectocele. And sometimes it could very well be that the sphincteric muscle just does not relax for whatever reason. It could be, anxiety, tension of going to a public restroom, and that doesn't relax and results in constipation, and that could become a problem for almost all of us, if that were to be a daily event. Accidental bowel leakage, on the other hand, is, you can see right here is the sphincter muscle, which is completely intact, but now here it is broken off here, so the muscle cannot tighten around the rectal lumen, and therefore it can result in bowel leakage. And that is also a big problem, because patients will say that I suddenly noticed stools in my underwear and I had no idea that it had come out. Genitourinary syndrome of menopause, as the term implies, this typically happens after menopause. And as you can see here, it's a nice, healthy lining of the vagina. And you can see it's a very thick, nice vessels. But if you look at this area, it's very thin. So it's not as thick as this. And this lining has also become very thin, and that is because of lack of estrogen, resulting in vaginal atrophy or thinning of the vagina. That can cause urgency, frequency of, and also it can affect the vagina by way of dryness, discharge, and pain during intercourse. Here too, you can see how thick that normal, robust lining is before menopause, and after menopause, this very lining becomes this thin, and that can cause the symptoms. So mainly thinning, pain, discomfort, irritation, bleeds to touch, and pain during intercourse. So as you can see, this is a classic vaginal atrophy. The vagina is gaping open because of the lack of elasticity. And then the cavity also is very thin and bald lining. It's not nice folds of the vagina, like a curtain like folds have disappeared. There is prolapse of the urethra. There is redness of the vulva from vulvitis. There's that vaginal discharge from the atrophy. And all these changes are because of the lack of estrogen. So now we've seen the different conditions, the urinary conditions, the vaginal conditions, whether it is the prolapse or whether it is atrophy, and the bowel conditions. And they have a significant negative impact on a woman's physical, emotional, sexual, and financial well-being. And they affect not only the patient, but even her partner, and therefore their marital life. Now that we know what these conditions are, let us find out how common are these conditions, how frequently do each of these conditions happen, and what do women do? Do they get them promptly corrected, or do they wait a while before getting this taken care of?